News today. Now, the details: the Kyebi Government Hospital in the Eastern region, typical of most public healthcare facilities, is not as adequately equipped as the authorities would want it to be. Most of them, for years, have had to grapple with challenges ranging from lack of enough staff and their accommodation and logistics. What the Kyebi Hospital needs the most, however, is chemistry analyzer for its laboratory. Emefa Ewenam Atiamoah Eli has more.
The Kyebi Government Hospital is one of two district hospitals serving the Kyebi and East Achim districts. Per its strategic location along the Accra-Kumasi Highway, it remains the first port of call for especially victims of motor accidents and for residents in the surrounding communities. The chemistry analyzer is just one of the many things the hospital lacks. But the laboratory technician believes it is the one thing that impacts most significantly on healthcare delivery.
When a doctor diagnoses something concerning liver or kidney, now this is clinical diagnostics. Then we do biodiagnostics with the chemistry analyzer. We actually take your sample, like blood, take the serum, and then we go and then analyze and see whether really the kidney or the liver is being affected. Now, any internal organs, these are the analyzers that you use to actually determine them. And then most of the problems are on the HIV patients because the T cells of the patients are always very low, and it puts pressure on the internal organs, especially the liver and then the kidney. And they need to do all this at least every month.
Hospital authorities say the lack of the analyzer means the patients are referred to nearby private facilities, except they never return for the doctors to complete their diagnosis and treatment.
Okay, it will cost the person not less than 200 Ghana when you go to.
But assuming it were at the government hospital here, how much would you have been charged?
Okay, we have the this in what you call health insurance covers it. So we have the this in the list here. We have the insurance that's non-insured. This is price list for insured. And then we have the LFT is 8 cedis, 14 pesos.
Wow.
Yes, very cheap.
The Kyebi Government Hospital, as far as authorities can remember, has never operated with a chemistry analyzer. But there are other problems that need to be resolved. Among them, the lack of accommodation for staff, inadequate medical staff and limited space at the morgue. Some health officers posted to the facility never turn up, especially because there are no quarters to house them. A case in point is an ophthalmologist who is yet to take up the post because there was no accommodation when he first reported. The hospital, he says, is having to find a way around the problem.
Fortunately, we have an ophthalmic nurse who is currently in charge of the place, but there are certain cases which are beyond her capability, and therefore we will need the optometrist. Sometimes we want the staff to come, but even when they come, we don't have a place to accommodate them. And there's a labor ward now that is fully furnished, but it's not functioning because we don't have the requisite staff, that's the midwives, to man the place. So the place is nice, very nice for the pregnant women, but it's not being used because we don't have enough staff. If we should open that department to make it operational, then it means that we'll have to move the already inadequate staff from other departments to that place, and we cannot afford to do that.
The Deputy Director of Nursing, Madam Mary Yvonne Atipo, is meanwhile urging women in the area to quickly report to the hospital for antenatal care immediately they realize they are pregnant in order to avoid complications. Emefa Ewenam Atiamoah Eli for Joy News.
Well, welcome back to the studio. We have with us Isaac Ampoma, who is the advocacy officer of the Coalition of NGOs. He's also the president of the Concerned Health Education. It's great to have you today. I mean, it's a sad story, though. If we look at the situation at the Kyebi Hospital, it's a reflection of what happens in most hospitals across the country, really. I mean, as a member of the Coalition of NGOs on Health, what do you think is the critical step that we should all be taking to resolve some of these health challenges facing the medical facilities?
All right, thank you very much. Thank you for the opportunity. Yes, health system in itself generally is a major concern for all of us, and for that matter, as a civil society activist, I think we need to ensure that access to healthcare is there for everybody, and for that matter, we shouldn't even try to risk losing lives. So it is incumbent on governments to make sure that systems are properly set up for the health system to operate. But again, it is also a challenge.
Let's probe it bit by bit. I mean, you want access to health to be made accessible to all, systems put in place. What kinds of systems, really? We have the education ministry, we have the district, we have the health ministry, we have the various district health and municipal district offices. Are the systems not already in place?
Well, the challenge is that as citizens, we all look up to our leaders to provide the services for us, because we're giving them the opportunity, we're giving them the right to handle our resources. And even if the resources are not there, government should be able to be bold and step down and tell the people the situation, so that at least within the various private-public partnership, we'll be able to work closely to find out what is the problem. For instance, if a hospital does not have certain assets, it may not necessarily have to be coming from government. Private-public partnership can come on board to make sure such situations are fixed. I quite remember in 2008, policymakers and development partners raised an emergency on maternal mortality, and therefore the Millennium Accelerated Goal was established. The Millennium Accelerated Framework has laid down specific planned activities that needs to happen. We need to have anesthetists in our hospitals. We need to ensure that we have a safe delivery within the various hospitals. And these are the issues. Donors have put in their money, and it is up to us to demand government to make sure that health system is ready.
So you mainly will put this blame squarely at the doorstep of governments. Possibly you are suggesting that government is not putting in enough funding?
Well, we don't directly say government, but at least we want to take government on to create that platform for private-public partnership to engage, so that government should be open enough to tell us the problem. You know, not try to all the time try to find, you know, other excuses. We know that health system generally is a problem, not only in Ghana, across Africa, and even the developed world. You understand? So it is up to government to say, hey, let's all bring our resources on deck, and let's try to see if we can find a lasting solution to this health situation.
So let's look at the key problems. I mean, one, the shortage of doctors, or the inability of doctors and health workers to accept posting to rural areas. What are the problems? What other problems are there? Because I mean, obviously, we don't know the problem.
Sure.
We can't begin to think about the solution.
Certainly. Every human being would like to work in a very good environment. You know, the doctor believes he has been trained. He needs to be posted to an environment where facilities are available. First of all, a doctor denying or refusing to go on postings is wrong. We are not promoting that. Every doctor, irrespective of who you are, you have the right to serve the people, because that is your profession. Again, also, let's find out why doctors aren't going. For all you know, there are lack of accommodation. There are other environmental challenges that the doctor may not stick to. And these are issues we need to discuss. But then again, it also called for, you know, it's a bigger platform to invite other stakeholders on board, you know, to discuss how best we can all make the health system work. Yeah.
But do you think there's hope, really, to resuscitate the health system?
I think the health system has done well, looking at the past 20 years. But yes, still there is a lot more to be done. And I believe when collectively we all work hand in hand, we'll be able to achieve that optimal health that we are all looking for.
I keep asking whether the National Health Insurance System, in your view, do you think that it's not perhaps time for the National Health Insurance System to be equipped or revamped to make it strong enough to step in as the as a fund provider for some of these hospitals who are collapsing?
I think currently the National Health Insurance Scheme has done well. Of course, it started from, what do you call it, pay system, where of course now it's now moving gradually into a capitation. The capitation was piloted, and I believe currently it is time to roll out the capitation to other regions.
There's been many questions over whether the capitation is the right thing and not. I mean, what's your position on this capitation thing? You think it's the right thing, right approach?
I think by the act, the capitation is mandatory and it is legal. Of course, we need to find out how best it will help us all. Having piloted it, I believe we can learn the experiences of the pilot and then use it to cushion the shocks or the effect. So that we all work closely to ensure that we live in a very effective health system, that we can be assured of reduction of maternal mortality and also have a bigger hope for our children to come.
So beyond public-private partnerships, what else?
Well, I think the citizenry in itself needs to also work hand in hand.
How?
Optimal healthcare is not only the health practitioner, it is also communities, societies, religious bodies, and everybody. But then we also hold government accountable to make sure that systems are there for us to effectively make this a success for all of us.
Right. We're very grateful that you could make time with us. And then Isaac Ampomah is the president of the Concerned Health Education and is an advocacy member of the Coalition of NGOs. Now,